my question happens to be about this Kawasaki syndrome related uh, thing with COVID 19. It can't be a coincidence, obviously. There's some sort of connection. What do we know so far about this connection between this inflammatory syndrome and COVID 19 in children?
Thank you for this question. I can start, and perhaps others would like to supplement. So, this syndrome, we're calling it multi-system inflammatory syndrome, is a condition that was alerted to us from our colleagues in the United Kingdom a few weeks ago, 2 weeks ago. And it's a very rare condition which is causing an inflammatory disease in young children. What we've done with that information is that we've discussed this with our global clinical network, which is a group of clinicians across the world who are dealing with patients for COVID-19, and specifically talking with our pediatricians who are part of that global network. And in doing so, asking who has seen this in their countries, where they have seen it, how often they have seen it, what this syndrome actually looks like. And in doing so, raise the alert among this global network. We've heard of additional reports in a few countries, including the United States, including Italy. And so we're learning that it seems to be a very rare syndrome, but we need more information. And we need more information collected in a systematic way, because with the initial reports, we're getting a description of what this looks like, which is not always the same. And in some children, they've tested positive for COVID-19, but other children have not. So we don't know if this is associated with COVID-19 or not. So what we've done is, through our clinical network and together with our partners, is put together a case report form. So this is a data collection tool in which clinicians can use to collect standardized information so that we can better understand what this disease looks like, how we can better develop treatments for this. And that's important. So far, we understand that it's rare, but we are hearing more and more reports about it because people are on the lookout. So as the Director General has said, and as we've said, that we need clinicians to be on alert for this, to look for it, but also to ensure that we collect standardized information so that we can better describe what this is, and so that we can develop better treatment.
CNN, Michael, can you hear us?
I can hear you loud and clear. Thank you for taking my question. I'm Michael Bosick, a contributor to CNN Opinion. And just quickly, I think I speak on behalf of all of us when we express our gratitude for your forthrightness with these press conferences. They're very helpful. May I put this question to you? At the 70th WHA, the Russian Federation presided over the forum for the first time, as you know. And at the time, the Minister of Health said it was, quote, an acknowledgement of Russia's achievement in developing its health system, unquote. And yet the Russian Federation is now registering the second highest caseload of COVID-19, 262,000 cases plus as of today, 10 to 13,000 on average being added every day. And death rates are suspiciously low. I think it's over 2,000. Just quickly, the question will be coming. The head of the Doctors Union in Russia told me among the sick and dead are many, many doctors and frontline healthcare workers who are being forced to work without PPE. They're stressed and being forced to go to work. Some reports of doctors mysteriously falling out of windows. And just quickly, a former U.S. ambassador to Russia I interviewed told me over the past 10 years has been a wanton destruction of the healthcare system with hundreds of hospitals closed. What is your assessment of what is going on in Russia? Since day one, you've advocated very forcefully and passionately for healthcare workers, and surely this is a situation where WHO can find a voice. Thank you.
Thanks, Mike.
I think, like all systems around the world, or many systems around the world, when you see that rapid rise in cases, systems can struggle to cope with that caseload and with adapting to that and adjusting and being able to deal with it effectively. Certainly from the perspective of the Russian Federation, they've been very good at ramping up testing and making testing more available, but it is clear in certain areas that the number of cases is stressing the healthcare system. and there have been a relatively low number of reported deaths, and we're looking at that with our colleagues in the Federation from the perspective of the way deaths are recorded. And I think this is another issue we're seeing around the world. Here is the death recording related to a post-mortem diagnosis where a physician declares or